Hi everyone! Okay, so I'm going to try to make this as short and sweet as possible. First of all, I want to thank everyone who's been inviting people, who's been liking, commenting, sharing any posts on the boys' Facebook page. Really appreciate it. The boys are turning 1 year old on the 30th of May. And since that's happening, and we have quite a few new followers on the Facebook page, and some people have been asking, I've decided to dedicate this month to doing a little bit of a recap and bring everyone up to date until this fall. So this video is going to serve as a summary, a medical summary. I'm going to try to make it as short and sweet as I possibly can, and then I will try to make a few, like a mini series almost, where I go into a little bit more detail of our whole journey. So this will basically just summarize the medical part and the diagnoses, plural of diagnosis, of the boys. In terms of that, I'm not a medical professional. I might incorrectly pronounce some of the terms, and I really don't hope this happens, but there's always a possibility that I might have the incorrect information. If there is anyone that wants to correct me or to enlighten me, please feel free to do so. I'm all for learning and educating myself. I feel it's my responsibility as a medical mom to keep up to date as far as possible. Okay, with that being said, let's start at the beginning. So I feel that the boys' medical journey starts with our first sonar. We went to a sonographer, and she was almost immediately able to tell us that we were having twins, okay, which was amazing. And then came the but. The but was that Samuel had what is called a PUV. Okay, so now I just need to get my notes. Posterior urtheral valves. What this means in layman's terms. His bladder was full of urine and he was not able to express the urine. This is important because babies, the way that they create the amniotic fluid, or how the amniotic fluid gets circulated, is by urinating. This is then also very important for the time where their lungs get developed, because they actually breathe in the amniotic fluid. Okay, so that was kind of scary. The first case of the roller coaster that we were going to be on, because fantastic news, we got twins, horrible news, there's a PUV. And then also the unknown, because we needed to see a neonatal specialist. What I do remember and what sticks with me during that appointment was when the sonographer mentioned that there's a possibility that we would have to terminate the pregnancy. And her words were that if you have 2 babies with this pregnancy, it will be a miracle. Okay. A wonderful doctor, not saying that sarcastically at all. She was an absolutely fantastic doctor. And she was able to organize our next appointment with a specialist, which was just another amazing doctor. And at this appointment, the diagnosis for PUV was confirmed and our options were laid out. So we had one of 3 options. Number 1 was to terminate the pregnancy. Number 2 was to let nature run its course. Sometimes PUVs have a tendency to correct themselves, but there's no way of knowing that in advance. And then the third option was to intervene in terms of actually putting in a stent. So an operation while the babies are in utero, inserting a stent which would allow the fluid from the bladder to actually go into the amniotic sac. Also, just to mention that the boys were monozygotic twins. In their case, they both had their own sac but shared a placenta, which also poses its own risks because it needs to be monitored to make sure that both babies are getting enough or equal amounts of nutrients, which also could make the pregnancy a high-risk pregnancy. But I almost want to say that wasn't our biggest concern. We knew that it was something to be concerned about or that they needed to check on a regular basis, but that was definitely not the biggest concern. Okay. So after a while, we decided that we were going to opt for option 3. For this to happen, I needed to go in 3 times so that the urine can be extracted 3 times. They do this for multiple reasons, one of which is to actually test the urine for certain enzymes to make sure that the kidneys are actually working. The kidneys need to work, or these enzymes need to be present to actually get approval to insert the stent. If the kidneys aren't working, the stent won't be approved by, I'm sure, your medical aid, or it would be considered too risky. I'm not sure. Any case, our test came back positive in terms of the kidneys were working, the correct enzymes were present, and we got the go-ahead. So in week 17, first sonogram was in week 12, week 17, even, I think it was earlier, couldn't be week 17. Any case, a little bit later, we went in. So I was put under sedation, not full anesthetics, but under sedation for the insert of the stent. So through my stomach into Samuel's bladder. And this allowed the urine to actually flow freely into the amniotic sac. This in turn, and this one was one of the risks, like this is not a, even though in my mind it was a heal-all, this was my Hail Mary, this was my solution, our solution, but it wasn't that simple. So what happens, obviously, needles going through the placenta and the amniotic sac, it creates little holes, little perforations, and in my normal scheduled update with my gynecologist in week 23, I mentioned that I'm leaking urine, and his eyebrows raised and was like, we need to test that because it's not necessarily urine. And he asked a lot of questions about how's it happening, blah blah blah. I just assumed that it was urine because I know sometimes women leak, and I had to, and I was going to the bathroom more, and it wasn't like it was like just before I needed to go to the bathroom. Too much information, sorry. Okay, so in any case, tasted it. Turned out it wasn't urine, it was amniotic fluid that I was leaking. Gynecologist took me by the hand. Magnets was strung along, and we went to the maternity ward. He explained that new bed is basically where I'm going to be until these boys arrive. and that Marnit was going to go home and pack my things. This was my new reality. The reason why you are put on bed rest, obviously less movement, less fluid can go out your body, but also not only that, there was a risk of infection. Since there's an opening, infection can occur. So a whole lot of tests on a regular basis to make sure you don't get infected, blah blah blah. They also check on the boys and their heartbeats on a regular basis while you are in bed rest. Again, I'll get into all the nitty-gritty details and how my emotions were playing and everything during this month. It's really going to be a mini-series, but we're already at 10 minutes and we're not even halfway through this story yet. So in any case, okay. Week 26 of gestation. Samuel went into distress. So I had to go in for emergency C-section. That happened. Get into more detail with that when the time comes. And the boys were in NICU. I got just discharged. They were on ventilators of some sort for a very long time, on oscillators. I'll get into that later. Oh, I don't want to say that the whole time, but in any case, you get the gist. And about when they were there for about 2 months, the pediatrician started actually telling me straight in the face. I don't want to say oblivious, because I don't think I was oblivious throughout this whole thing. It was just that I'm way too positive and I had faith. Faith that doesn't make any logical sense, that everything was going to be okay. So every time they would say anything to me and try to tell me the risks, I was just like, nah, not gonna happen, not going to be us. Everything's going to be fine. For most of the parts, obviously I wasn't always on this high. There were times when I was down, but for most of the time, I was on this high. But the pediatrician started telling me that the boys aren't where they need to be in terms of their lung development. They were going to have to do some tests, and they mentioned a chronic lung disease. They were assuming that it's a kind of chronic lung disease. They did blood tests, genetic tests, and eventually they did a lung biopsy, which is kind of scary. They actually cut they took a little sample of Samuel's very premature lungs and used that to diagnose the boys and their chronic lung disease. Okay, so the diagnosis that they got was pulmonary interstitial glycogenosis. Okay. How it works exactly, I'll need to recap and redo my research. But what I can tell you right off the bat now, it's very rare. Very, very rare. It was first diagnosed in 2002, if I remember correctly. So this is something very new. It's probably always been there, but has been diagnosed. Okay. It's a genetic disorder. So this was other than the fact that they were premature. This was other than the PUV. This was something that was new, a new diagnosis, and as far as I understand, wasn't a result of anything that happened up until that point. But our new way forward was that the way that they opted to treat this. Also experimental treatments, because it's so rare and because it's so new, there's no definite treatment for it. What they have been doing and what they found has been successful thus far is to do pulses of steroids. So a pulse would be, it will be every 3 months have high doses of steroids. This is what the boys did, and the steroids then encourages the lung growth. Okay, so Samuel, and the reason why only Samuel went for the lung biopsy was because they're identical twins. If it was because it's a genetic disorder, and because both of the boys were presenting more or less the same symptoms, they only needed to do it with Samuel. The reason why they chose Samuel is because strangely enough, you would think that he was the weaker baby in utero, he would be the weaker when they were born. This is not the case, apparently, because they start fighting from the very get-go. They tend to be the stronger. And he was a little bit stronger than his brother was at that point. With that being said, we started reaching a point where the boys were on ventilators for a very long period of time. And the next step was that the doctors started discussing the option of giving one or both boys a tracheostomy. So they actually make a cut incision here into your windpipe, and then they attach the ventilator through a trachea. The reason why they wanted to do this is not only is it more comfortable, but the boys needed to develop. And if they have a ventilator going through their nose and have to lay back the whole time and can't really move, it's not really, you're not able to interact. I also wasn't allowed to pick them up. I think the first time I was allowed to pick them up, they were already 4 months old. So that's how restricting the ventilator was. When it came to that point, we were discussing if both the boys were going in for a tracheostomy, how we felt, were we giving them permission. Benjamin at that stage was like, I almost want to say like at least 3 times a week pulling out his, and he needed to be re-incubated, which is traumatic, not only for him, but the doctors need to actually be phoned in to do it because the nurses don't do it on their own. And it was obviously traumatic for the nurses as well. And luckily I wasn't there, because then it would have been greatly traumatic for me too. So yeah, at least I wasn't there every time they decided to pull out this little pipe. Okay, so after discussion, and it was a whole team doing this discussion, and again, just want to reiterate, amazing, amazing, amazing medical care that the boys have been receiving. They decided to give Benjamin the trachea. The reason was, even though Samuel was a stronger one at that point, Benjamin was pulling out his pipe very regularly. And because Samuel was a little bit stronger, they were thinking there's a possibility that he might wean himself off of the ventilator and go on to CPAP, which would be a mask and would be less invasive, which meant he wouldn't need the trachea for a longer period. Okay, so Benjamin then went in to get his trachea, and it was a freaking amazing. It was really amazing. Like the change in his personality was just like, he was just calm. So we were very, very, very grateful for that. Now Samuel has weaned himself off of all other oxygen and ventilation and everything. He's breathing room air permanently. It's fantastic. But the reason why he's still in hospital is because he still needs to go for a renogram. So I go back to the way first beginning, like right at the beginning, his PUV, that still needs to be sorted out. I still have absolutely blind faith that with his next renogram, nothing's going to be wrong. Like, it's just going to be a miracle and sorted itself out. So I say sorted itself out. I am religious. I believe that it's going to be cured miraculously. Danke Jesus. And except for that, Benjamin unfortunately has had a few episodes. I've been present for an episode, which wasn't really an episode. This was more like a panic attack. The reason why I say that is I just instinctively knew I get panic attacks. I remember having group. I don't even know how do you pronounce it in English. When I was small and I just could identify it. Like, that's how I reacted when I couldn't breathe and it was a panic attack. But there's also other episodes where his fists or muscles will spasm, and similar to epilepsy, but he still needs to go for an MRI to identify that. He is on medication for it, and it's definitely had a positive effect. I think the last time he had an episode was 2 weeks ago, and that was like the one before that was even longer ago. So he still needs to do that. And then obviously he's able to have weaned himself off to a point where he was on CPAP for quite a while via the trachea, and now he's on a speech valve, and the speech valve is similar to the normal oxygen. So it doesn't increase the pressure in your lungs. It doesn't actually give extra pressure, where the CPAP gives extra pressure. This only gives him oxygen. So they're weaning him off and playing around with that. So sometimes on the CPAP settings, sometimes on the speech valves, etc. That obviously needs to get to a point, and then he needs to go for an MRI, and then he'll probably be released. There's like a 99.9% chance that we'll be celebrating their first year birthday in NICU. If it wasn't for the coronavirus, there probably would have been a chance that Samuel would have been able to come out already. They are holding him back a little bit because of the surgery, possible, well, not possible, it's possible, but the possible surgery that might happen after he's been tested, his for his renogram. So they first want the results of that, and because of the coronavirus and certain surgeries not happening, and where he needs to go to be tested, and he'll actually have to go outside of the NICU, that all has an effect. So we're trying to be as patient as we possibly can for the boys to come home. But it's positive news so far. Okay, so that's from the beginning right through, and what we're waiting for next. If you made it this far, give yourself a pat on the back. Wow. I can't believe you've listened to everything. I really can't. Thank you again for supporting us and showing your love. If you think anybody might find this interesting or noteworthy or might help them through a difficult time in their life, please feel free to share it on. this is really greatly appreciated. And then hopefully I'll speak to everybody very soon with my mini series. And if I have a look at this time, it's probably going to be a lot of episodes in hopefully smaller chunks than this. But that, yeah, long story and a lot of detail. Okay, thanks everyone. Bye.